If a patient asks me what the test results are from like a scan, how much do I actually tell them? This depends on a lot of things. So first and foremost, a lot of hospitals have like portals for patients and family members where they have access real time to results from scans, labs, etc. And I say that because a lot of times, like families and patients actually read the results before the provider does. So how much I would tell them really depends on the situation. So I'm going to give you like a couple different scenarios. Let's say a patient CT scan comes back and they have a head bleed. I would not tell the patient or family that that patient has a head bleed. That's a very like significant diagnosis. I would for sure make sure the provider is aware and can come talk to the family. If the provider's not able to come by, I would try and see if they're okay with speaking to the family over the phone. Now, let's say a different patient has a head CT for altered mental status and it comes back normal. The radiologist reads it normal. And if the family's like chomping at the bit, like, hey, what that CT scan come back as? I would probably say, hey, the radiologist read it as normal, but we'll still wait for the provider to come by and take a look at it and talk with you about it. I feel like in those scenarios, I'm not going to call a provider and be like, hey, I need you to come right now and tell this family that the head CT is normal. The provider was going to be coming by soon or touching base with the family soon, then I may not say anything at all. But I'm not going to wait, like put the family on edge or the patient on edge when the exam came back normal. Again, I am not diagnosing anything. I am not interpreting anything. This is just reading what the radiologist wrote. We're put kind of in a tricky position as nurses because a lot of times, let's say your patient gets an ultrasound for a DVT and it comes back positive and the provider's aware, so they order a heparin drip. And now you're going into the room starting a heparin drip, and the patient and family are like, well, what is this for? And providers are spread thin, super thin, and they're not always able to come and directly talk to the family about it. And I get that that's not like the best case scenario, but sometimes we're kind of bridging that gap and providing a lot of that communication. Use your best judgment. As long as you're not diagnosing anything, you're not giving a prognosis, you are relaying information that has been relayed to you, just be smart. Okay, I hope that gives you some clarity. I feel like it probably just made things messier for you, but let me know.